2 years ago, Americans watched in horror as a crisis unfolded at the Kabul airport.
There's desperation and anguish.
More than 80,000 Afghans have since arrived in America, but this story is still unfolding. I'm Andrea Martin. In my new podcast, Stranger Becomes Neighbor, we'll find out what happens to these new arrivals in our communities. Who would help our newest neighbors? Follow us at kslpodcast.com, Apple Podcasts, or anywhere else you listen.
Hey, welcome to Project Recovery, a podcast about addiction. More importantly, it's about recovery. And it's brought to you by useonlyasdirected.org. They've got a three-part solution with the opioid epidemic. It is speak out, opt out, and of course, throw out. Now, in case you didn't know, May is Mental Health Awareness Month, and we thought we'd bring Dr. Matt in for a bonus episode. Now, when we're talking about addiction and mental health, Dr. Matt, sometimes it's like the chicken or the egg. If you see where I'm going with this, sometimes you don't know if the addiction is a result of the mental health or the mental health is a result of the addiction. And I don't know if there's ever been anything conclusive to say which way or the other.
Well, I think it's both. I mean, it can be both. Mm-hmm. So each person's situation may be different. Certainly, we've had guests on this show where either they or a loved one obviously had a pre-existing mental health condition, major depression, anxiety, bipolar, something like that, that led them to try to feel better, and feeling better immediately doesn't happen right away with treatment, but you can get some relief from drugs and alcohol. And so that can kick off.
Self-medicate.
Yeah, that self-medicating can kick off an addiction. And then, of course, it can happen the other way, where a person, is having an addiction which creates anything from depression and anxiety, paranoia, to psychosis even. So you can have people that create, brain damage basically from their addiction creates various types of mental health issues. So they're really one and the same. And when we talk about mental health, we put substance abuse disorder is the term. That is a mental health disease.
Now, you said something last week that got us thinking of we should do this. Is that, right now the COVID-19, the corona, is a pandemic, and that's what everyone's kind of gearing for. But you said the next epidemic you think, or what scholars are saying, could be a mental illness epidemic that's coming from all of this.
Yeah, well, at least partly influenced by this. There are a lot of people who, there's what's called the diathesis stress model of mental health, not to get clinical, but the model there is that a person has an underlying predisposition or tendency towards mental health problems. And if most things in their life are supportive and going well and their health is good and finances are good, then maybe those things don't really come to the surface. But given just the right type of stress and pressure at the right or / wrong time in life, that can bring to light that mental health problem that the person has. And so everybody right now around the country,
it's a perfect storm.
We've had here in Utah earthquakes, and we're struggling with a worldwide pandemic, and that comes with unemployment. I spoke to someone about that this morning, and how hard that is for them. And isolation, loss of loved ones, or just more happening very widespread is chronic worry about the loss of loved ones. If you have elderly parents or grandparents and worrying about them, or if you have a child with an autoimmune or any sort of compromised immune system, these things are chronic stressors that we're not used to having. And so the worry is that more and more people will be struggling with mental health issues that otherwise may have been mild or insignificant in their life, but now are kind of coming to the forefront.
And you said, not to put your business on blast, but you're busier as ever.
Yeah, I think that most people in healthcare right now are very busy. Certainly mental health care, trying to figure out how to treat and provide support and help, medication, therapy. and stay safe ourselves. So doing telemedicine and things, it's a challenge, but we're all very busy right now.
So we're going to kind of let you take lead on this podcast. So what are we talking about today?
Well, I thought today, since this is Mental Health Awareness Month, I thought we'd talk a little bit about mental health, and we try to have a little bit of fun with it. It's not uncommon for a person to say, "Oh, Matt, how do you do your job? Don't you just come home and feel drained and awful at the end of the day and take all those worries from people that you talk with home with you?" And of course, at times that happens, right? But the reality is, I feel like psychology is very positive. It's very optimistic. People are feeling better and doing better when they come in and work on issues. So no, typically I think my job's fun. I really enjoy it, even though we can be talking about pretty stressful things in people's lives. So we're going to have some fun with it today.
I'm
How's
in.
that? A couple of things. I wanted you to know that about 43 million adults in America every year will have some level of mental illness that they have to struggle with. And that can be periods of panic or some, periods of depression. It doesn't necessarily mean, major mental health issues, but that's a lot of people.
43 million.
43 million in a country of a little over 300 million. That's a lot of people. And about half of all chronic mental illness, these are people who will struggle with it for years, begins by the age of 14.
That seems young.
So, well, it does, except for it also validates what we know, which is most mental health issues have a biological component, and that means there's biological development, and 14 is that early time when a lot of our biology is changing, and so about half of people who have chronic mental illnesses will show that by 14, and 3/4, 75% of people with chronic mental illness by age 24, and that's about when brain development kind of comes to an end, is in your early to mid-20s. So
let me ask you this real quick.
Interesting.
So say that I suffer from depression. There's a good chance that my offsprings would suffer from depression?
They'd be at higher risk.
Higher risk.
Yeah.
Just same like alcohol runs in the family.
Right.
And so depression would be sort of the same?
Mental health issues, we can see them run in families, absolutely. Does that mean that if your parent has a severe mental illness that you will too? No. But you're at much higher risk. Somebody who struggles with depression, anxiety, more severe issues like bipolar disorder or schizophrenia, we know that those you're at much higher risk, and you can look up the risk factors for each of those individually. And so that's why awareness of mental health is so important. And even within our families, like how many people in your family don't even talk about like heart disease or things like that? Are we at higher risk because of what Grandpa had?
So should this be a box on Tinder or Bumble?
No. No. But it should be a conversation that you're having. I don't think you need to advertise it to people you're trying to hook up with. But like,
I'm not trying to hook up.
I know, of course not.
Yeah.
But Leslie, he's not. But no, I think it should be a conversation. It shouldn't deter you from having a family, but knowledge is power, and going into it knowing, hey, if I struggle with anxiety, and my dad struggled with anxiety, then my kids are at much higher risk, so I should be prepared to be supportive and helpful and look for it at a young age. Just like, if everyone in your family has, struggles with heart disease, then, don't feed the kids bacon.
Got it.
Right? How about substance use disorder? Is that a mental illness? We talked about that already. Did you know that it is? Because a lot of people don't understand.
I remember how happy I was when I found out it was a disease. I said, I thought we just told people that to explain it. But when they go, no, it really is a disease.
To kind of make an excuse.
To make an excuse.
Yeah.
I mean, I swear to God.
Yeah.
I used to go, it's a disease. And then I was in rehab, and they go, it really is a disease. And I go,
why did that make you feel better to know that? Like, what did that knowledge do for you?
Well, I think it made me come to grips with it a little easier, that it wasn't something that I chose. You know what I mean?
Right. You were drinking and your buddies were drinking.
Yeah.
And then your buddies grew up and you grew up and they grew out of it and you didn't.
Yeah.
And what's the difference?
Yeah. I used to think all the time, I was like, why can you guys stop? How can you walk away from a beer? I couldn't do that. I've told it time and time again that we'd be sitting at a table and everyone's like, all right, we're done. And I go, but I still got some beer. They go, yeah, we got to go. The game's starting. And so we'd get to the door, and I would go, oh, hold on, I forgot to tip, and I would go back and pound the beer. I could not walk away from it.
Couldn't walk away.
I couldn't walk away. Yeah. Like, it would mess with me.
Oh, yeah.
Mentally. I would be like, no. I
got to finish that
I got to finish that off.
Yeah.
And so when I found out it was a disease, I was like, okay.
And it empowers you to be less judgmental of yourself. I think one of the things that I hope happens every month of May and throughout the year is that we're working on chipping away at that stigma of mental illness when we understand that your experience wasn't just because you really liked beer, that there was a biologically driven reason why you couldn't put it down and your friends could. That empowers you to be less judgmental of yourself and to realize, oh, I need to take my treatment seriously and look at it differently. It's not just, I'm not going to drink for a week and then I'll be fine. I need to understand I'm not going to be fine like my friends are because they don't have this disease. I do.
Yeah.
And the same way we might look at someone's diet if they have diabetes. Does that make sense?
100%.
Like I can't eat the things in the way that my friends do. I need to take care of myself in a different way. Yep. So a couple stats, and then we're going to have fun. We're going to play a game. We're going to pit you and Josh against each other.
I love it.
Because nothing is more fun than when there's a winner and a loser.
Right? It's not a competition.
But did you know about 20 million it is, adults in the U.S. have a substance use disorder, and 10 million, so about 50% of those folks, also are struggling with another mental illness, so a dual diagnosis. So it's not just, substance use disorder is its own mental illness.
Right.
But 50% or 10 million people every year are struggling with that plus another mental health issue.
And that can't be good.
Well, it complicates the whole thing, and it's why it contributes to the tendency to want to self-medicate with your substance abuse disorder because you're also struggling with perhaps major depressive disorder or very commonly anxiety disorders.
Now, before we get to the part where I kick Josh's butt at this competition,
right?
If somebody's out there and suffering from depression, anxiety, substance abuse, we want to be a resource here at Project Recovery, and we can point you in the right direction. But if somebody wants to do it kind of anonymously, where are some of the best places they can go for some help? Of course, we say start with a therapist. Therapists are usually a good jumping off point.
They are. I would say I wish that therapists were as accessible to the
There's a waiting list for most therapists.
Right. Yeah. As like your pediatrician or family practice doctor. But those are great, actually, gatekeepers. So, there isn't stigma if you're saying, oh, I have a doctor's appointment, I'm coming up on 50.
Yeah.
Got to go get that.
Woohoo!
Yep. And so everyone just kind of says, yeah, but that's a great time making having a conversation with your family doctor and just saying, in addition to whatever else I'm here for, doc, I'm really feeling this way. Can you point me in the right direction? And most doctors have mental health doctors that they work with, psychiatrists, psychologists, things like that. So, that's a real easy way to go in. If you wonder if what you're struggling with is outside just the normal experience, if you think it might be a little bit more depression, more anxiety than the average person deals with, then you can always call a 24-hour line. Even if there's a national suicide hotline, which we've given that number out before. But locally, there's also 801-587-3000, which is the University of Utah's support line, and you can speak to a crisis worker, typically a social worker, 24 hours a day, and just say, hey, here's how I'm feeling. Give me feedback. And they're very good at helping you anonymously in the moment do some problem solving. They might say, yep, we'd really like you to come into the hospital. But actually, they're very good at saying, I think let's have you make an appointment with your family doc, or let's get you on a waiting list to come in and see a therapist. So those would be some of the ways that I recommend.
And there's also the app, Safe UT app.
Safe UT is another way to reach out, and you can ask questions about how you're doing, or if you're worried about a loved one, a friend, because unfortunately that stigma makes people feel like reaching out for help is weakness, or if I admit to having a problem, it's weakness, which is we've all felt, I think, but it's silly at the same time because who doesn't have problems? We all have problems. Nobody likes to admit that they have problems.
Jay-Z's got 99.
I know, poor guy. And we can support each other. So there are resources. But when people say, "Oh, I couldn't get in to see somebody," that's unfortunately, I'll just say that's usually an excuse because there are expensive options and there are free options.
So if you need some help, make sure you reach out and find that help. Like Dr. Matt is saying, it takes a real strong person to ask for help.
I admire people who come in and say and just lay it out and say, "This is how I'm doing. I'm struggling with this and that, and let's talk about it." That takes a tremendous amount of courage.
The National Suicide Prevention Lifeline is 1-800-273-8255.
And people need to know that you don't have to be actively suicidal. You can be, to call that number, but you can just be feeling really low and wondering what to do next, and they can give you some direction. What's the number again?
1-800-273-8255.
Okay. Well, hey, let's jump in and let's have a May is Mental Health Awareness Month quiz, and I have a prize for the winner between Casey and Josh.
Okay, let's go.
We have 10 questions.
Okay.
All right. And do I have something to write down? Who's going to keep score? Look, there's.
I will.
Right.
It's a brawny.
You going to write in the brawny? There's a piece of paper right there. He's writing on a paper towel, guys. Is this how they did it at Ogden High?
No, this is how they did it in recovery.
Oh, okay. Good enough. All right. Okay. Approximately what percentage of homeless adults have a serious mental illness? Not just that they're bummed out because they can't take a shower, but what percentage of adults do you think, I'm just going to go who's closest, have a serious mental illness? Josh, you got to go first.
Ladies first.
Oh, gosh. I wish we could have done some research here prior to this, but
you could have.
I'd say 67.
I'd say 75.
Well, this says about 26% of homeless adults.
Wow.
And I'm suspicious that it's higher than that there are a lot of undiagnosed folks. But we're going to give that to Josh. Point to Josh.
Sucker.
Now, one of the things that a lot of people don't understand is that mental illness actually costs. This is for people who are maybe you don't believe in mental illness or you discount it as not important and maybe it's all about finances and business in your life. Well, did you know that it costs in the billions of dollars in missed work and legal fees and all sorts of things, problems that arise from serious mental illness every year? It's in the billions of dollars. How many billions of dollars each year does it cost America?
I'm going to go with 7.
7 billion?
Yep.
Ooh, that's a high number. Josh, what do you think?
Oh, if that's a high number, I was going to go higher than 7.
No, 7 billion is a big number. I didn't say it was, I didn't say it was right.
I mean,
or
just
wrong.
think about how much money we make. I would say 7's high. 2.
Think about all the missed work that happens.
Yeah,
Most people don't
know.
call in sick, by the way. The vast majority of people that call in sick to work, it's mental health. The vast majority. It's not because you got the sniffles. People show up when they've got the sniffles. But depression, anxiety, that's what causes missed work.
I'm going higher than 7. I'm going to say 24.
About $190 billion.
See, I wanted to go higher, but as soon as you said 7 was high, I was...
That's the estimate, yeah. As of a few years ago, so it may be higher now. I don't know.
Wow.
She's got 2 points.
Yeah. Okay. What is the most common mental illness in the United States? It affects about 40 million adults in the U.S. ages 18 and over every year. What mental illness? And you don't have to know the exact name of it. What's the category do you think that is the most common?
On the count of 3, we'll say it.
Okay.
1, 2, 3. Depression.
General anxiety.
Point to Josh.
Dang it.
Just anxiety disorders are the most common and affect about 40 million. And that's why in the atmosphere that we're living in right now, in this quarantine pandemic, you can see how everybody's stress is higher. And if you're prone to having an anxiety disorder, you may be really struggling right now.
Yeah.
3-0.
3-0.
Wow.
So Josh,
shut out.
I'm a fourth quarter player.
Oh, are you?
Yeah.
I believe it. Now, we know that May is Mental Health Awareness Month. How long's that been going on, that it's been officially mental health? I'm just going to have you guess a decade.
Okay.
pick a decade from the past. I'll say it's not the 1800s.
Josh has only been alive for 2 decades.
Yeah. 3 decades. I would say, actually, go ahead. You go first.
I would like to think that it's been 50 or 60 years ago, but I don't believe so.
There's no way.
I think it's probably the 1980s.
80s, okay.
Oh, wow.
Josh?
See, I'd say 2010s.
The 2010s.
Yep.
1949.
Wow.
Now, that comes in the wake of World War II when shell shock was this new sort of diet. Well, it started in World War I. World War II, we started to realize people who have these horribly traumatic events in these mass numbers, all of a sudden they're struggling what we call PTSD now, post-traumatic stress. Wow. And so there was a lot of mental health research. How did the Nazis get away with doing what they did? Why did people follow them? Mental health, understanding people's personalities, PTSD. There was a lot that came in the wake of World War I and World War II. And so as early as 1949 was the first time we had May as the Mental Health Awareness Month. But I really think it's just since the 80s that it's gotten a lot of traction. I think it took 40 years for things to start to change where people wanted to be involved in changing that stigma. So it goes back farther than we think. Okay, what's our score?
3-1.
All right. A phobia is an irrational or extreme fear of an object, situation, or a setting. Okay, that's what a phobia is. What is the most common phobia for Americans? Just a category. What do you think is the most common phobia for Americans?
I want to do something easy like spiders, but
Clowns?
Clowns? I'm going spiders.
I'm going to go with being alone.
Oh, yeah?
Yeah.
Loneliness?
Loneliness?
Do you need a hug?
No. I mean, I'm good.
Public speaking.
Really?
It's still the number one
one
phobia that people... Now, this is a hard one, I'll have to admit. If you look up research on phobias, you can get a wide variety of answers. But as far as I can tell, public speaking is still considered the number one phobia. Fear of heights is number 2.
See, those don't scare me. You know what really scares me?
What?
Yard work.
Oh, my gosh.
It scares the crap out of me.
Is it because there's spiders? Because that's number 3.
No, I just hate yard work.
Well, animal phobias is number 3, and spiders are the number 1 animal phobia, followed by snakes, wasps, mice, and dogs.
I'm going to take that one.
Do you know
what are you talking about? You can't have that.
Yeah, I can.
That's cheating.
I'm the host.
Did he get that?
I'm editing this out.
Okay. You guys can fight over it. Did you know what? Spiders and snakes are number 1 and 2 in animal phobia, and there's an evolutionary explanation for that.
What is it?
That is that it's kind of pre-programmed in us as human beings to be afraid of creepy, crawly things that can poison and kill us, because there was a time when human beings lived more with the elements, and you could be a healthy person, but if you had a snake slither into your campsite and bite you. So people who became really hypervigilant about those things survived, and those who didn't.
Yeah.
And they may have passed on that genetics.
You know who you just described?
What?
Indiana Jones.
There you go.
Oh, my
Indy
gosh.
knew what he was talking about, right?
I hate snakes. Snakes?
Okay,
Haven't
number
seen it.
6. Question number 6. Distractibility is a very common symptom of what mental health disorder? Anxiety, depression, or ADHD? A very common symptom.
ADHD. I don't even know if I needed multiple choice for that.
Well, I don't think that's it. I think you're kind of throwing us. That's a red herring. I'm going to go with anxiety.
Well, you both get a point because it's all 3. And the reason I bring it up is that distractibility is often identified with ADHD because it is the primary or one of the primary symptoms of ADHD. And that's why ADHD has been so overdiagnosed in kids. Because
is he distracted? Yeah.
Teachers and parents often say, he's very distractible, and he's kind of rambunctious, so he's probably got ADHD, instead of having a proper mental health evaluation. But guess what? If you're highly anxious and you don't know how to tell anybody about it because you're a kid, anxiety creates a ton of distractibility, right? And depression as well, and things like learning disabilities and lots of other things. Distractibility is a common symptom of everything. You're right. It was a trick question, sort of. But
that's that
I'll give you
med
both
school
a question.
quiz right there.
Yeah. All right. What's the most common substance use disorder? And I'll give you 3 Is it alcohol, marijuana, or prescription drugs?
Is this another D, all of the above?
No.
All right.
I'm going to go with alcohol because I think it's more prevalent, it's more socially acceptable, and I mean I think opioids is certainly raising in the ranks, but I'm going to go with alcohol.
Okay. Josh?
Dang it, I was going to go with alcohol too.
Well, you can choose that. You can both choose
all
the
right,
same thing.
alcohol, yeah.
You're right, alcohol, and for those same reasons, right? While we have marijuana and prescription drug abuse on the rise, of course, as they've become more and more available to people, alcohol is still number one. A couple movie questions for you.
I'll get these. It's 5-4 currently.
For Josh.
Yeah.
Okay, come on, fourth quarter, buddy. Glenn Close portrays a woman with a mental health disorder
Fatal
in
Attraction.
the film Fatal Attraction. Thank you. What was the mental health disorder primarily? I mean, I think, it's a film and don't everybody, get too, technical. But what was she trying to portray? Was it bipolar disorder, obsessive compulsive disorder, or borderline personality disorder?
Ooh.
Fatal Attraction. Let's go back to the 80s.
I don't even know who.
She
Glenn
boiled
Close
the
is.
dude's bunny on his stove.
Yeah, if you haven't seen this movie, it's a classic.
What was third choice?
Borderline personality disorder.
Yeah, borderline personality disorder.
That's your answer?
Yep.
I'm going with A.
The bipolar?
Yeah.
Josh gets a point.
Dang it.
Borderline personality disorder.
Didn't even see
She
it.
had some other stuff going on, I think, in that movie, too. But
Michael Douglas was in that, right?
Yeah.
Yeah.
Oh, yeah, it's a classic. It's a great film, actually. And Glenn Close, by the way, has been a big proponent of mental health. She often, during the month of May, is found speaking in different places. And this is public knowledge. Her sister has struggled with severe mental illness. And so she's been, I think she has said that from a young age, she wanted to advocate and reduce that stigma.
Taking it up as a cause.
Yeah, exactly.
That's awesome.
Jack Nicholson portrays a man with which mental health disorder in the film As Good as It Gets? Same choices. Bipolar disorder. Oh, no, I threw in a different one. Bipolar disorder, pica, or obsessive compulsive disorder.
So that's As Good as It Gets. That's with Helen Hunt.
Right. Another classic, if you haven't seen
Greg
it.
Kinnear. They had that little dog. I'm just trying to remember. I didn't see that because I'm a dude.
Oh my gosh.
It's a good movie. That's a good movie.
I'm going with OCD.
I'm going to go with pica.
Okay. That's dangerous when you don't know what it is to
I know,
guess
that's-
that, but it is
that's
OCD.
very-
Point for Josh.
That's very Casey Scott-esque.
What is pica?
The whole movie's about him obsessive compulsive. The problem I have with As Good as It Gets is once he falls in love, OCD goes away, and just, by the way, that doesn't work.
Oh, it doesn't?
No, otherwise, I guess
Everyone would just be in
Tinder
love.
would cure OCD or something.
Yeah.
I don't know.
I thought you were trying to flex your big brain and throw pike out there. So are we going to...
Pica, I'll tell you what it is.
Yeah.
Pica is a disorder where people eat things that aren't food.
Oh.
And so they'll, for some reason, their brain, various reasons, various contributing factors, but they will eat objects that are not
Like
really
My Strange
ingestible.
Addiction.
Yeah.
A
It's
side
been
note,
featured on that many
There
times.
was a whole episode on Bull. It's a TV show, and it's based after Dr. Phil, and the girl was suffering from pica.
Oh, okay. There you go. So
Wow.
people could look that
Now
up.
you know.
All right,
Point
last
for me.
question. What's our score?
It's
7-4.
7-4?
well, I guess yeah.
Don't you cheat. I see that.
I run an honest program, Joshy.
Well, then it'd be 7-2.
7-4. Okay. So this last question is worth 3 points.
Okay,
Oh my gosh.
I love it.
Come back for the tie here.
I'm doubling down.
In the United States, oh wait, let me see here. So in the United States, what percentage of people with a mental health disorder during this past year actually received professional care for their mental health disorder? So of all the people that had struggled with a mental health disorder last year, what percentage do you think actually were able to have professional health care?
15%.
Oh my gosh. So out of like the 43%, I would say 17%.
So 17, what was yours?
15.
Low, but still it's unfortunately low, 41%.
Wow.
So Josh gets 3 points. He beats you 10-4. I was going to have you guys play Bloody Knuckles if you could have tied that. It's a
All
good
right.
thing that we're not.
That'd be cool.
Come on over here. I'll smack you. Hey, we did have some fun with this and have a competition, but I think this goes long ways to show the severity of mental health and the stigma, and you don't know what some people are going through. So once again, I think kindness, compassion, empathy are really what we should lead with and get a better understanding of what somebody's going through.
And I'll add to that education. They're unlike 1949 or even 1989, the research continues to go on, understanding continues to go on. Don't hold on to your own beliefs, your old beliefs, I should say, about mental health or substance use. Go and look up the research. Center for Disease Control. Actually, my favorite is for this sort of thing is National Institute of Mental Health. NIMH.nih.gov is a wonderful resource for anybody who wants to look up and find out what we really know about mental illness in the United States and around the world.
But I would caution people to use that as a good jumping off point.
Right.
Don't self-diagnose.
No. Don't self-diagnose. But if you want to break down the stigma, you need to learn.
Yeah.
Like education is how we break down the stigma, how we learn things. I can tell you that, I went to my undergraduate in the early 90s, and from that time till now, in 30 years, we've had a tremendous growth in understanding of mental illness, substance use. And so I need to keep on top of learning what the new research is. And everybody, otherwise what you're doing is you're dogmatically holding on to old stereotypes, old stigma, things that are steeped in fear and misunderstanding. I believe that one of the reasons we still have such a stigma with mental health in the United States and around the world is because you can't see it overtly in the same way you can other diseases and disorders, cancer or things like that.
And just remember, because it's not happening to you doesn't mean it's not happening to someone you love, know. And that's where that education really comes into play, is that, I think a lot of times ago when we thought, hey, not me, not my kids, this is not in my family, but it might be. It might have skipped a generation. It might be a loved one. It might be someone you married into. And so an education will really go a long way to help loosen up that stigma.
Absolutely. And I want to sort of end this segment. Obviously we've tried to have some fun. You should educate yourself. You should learn about mental illness and how it affects. But you know what? There's treatment. And there are medications. I know a lot of people say, I don't want to be dependent and blah, blah, blah. The reality is you're not educated on the medications. Medications have side effects of all sorts, and so there can be problems. I'm not downplaying that. But the medications that are available today compared to when you and I were growing up are light years ahead of where it used to be. And so there are some good medication options for various things. There are a lot of therapies, and therapies are specific. That's one thing. I don't do medication, but I do therapy. And one of the things I try to teach people is, listen, therapy isn't just one thing. Therapy, you got to get over the Bob Newhart idea of just going in and sitting on the couch and telling, stories about growing up. I mean, I guess that might be part of it. But the reality is there are specific therapies, acceptance and commitment therapy, cognitive behavioral therapies, dialectical behavior therapy, that fit certain disorders and needs that a person has. If you are struggling with grief and loss, if you're in substance abuse recovery, if you have a specific disorder like obsessive compulsive disorder, you need to work with a professional and find out what therapy is there, because therapies actually are targeted to retrain how your brain is functioning. So it isn't just somebody to cry with and use some tissues with. There are specific therapies to help specific mental health disorders. And a lot of people don't know that. A lot of people have no idea that we don't all in our offices have a Victorian couch and I sit behind you and doodle. That would be a lot easier. But there are effective therapies today that people should look into, including things like group therapy for various issues and day treatment or hospital treatments. There are a variety of things that if you'll reach out, find out what your concerns are, find out what's available to you, you can feel better. And I would highly encourage you to do that.
Because, I think you just said something, you can feel better. I think a lot of Americans, those who go undiagnosed, those who go without help, have just either resolved that this is how it's going to be. And they just go, okay, this is what it's going to be.
As good as it can be.
But it's not as good as it can be. It can always get better.
It can get better. And in fact, in some cases, people can be symptom-free. Now, the problem with some of these things is we might say depression. Well, to some degree, something we call depression might be part of life. We feel down, we have the blues. That's not major depressive disorder. Getting proper treatment, a person can be free of that. And I would highly encourage you to realize this is the only life you get. This is the only body you get. You need to make the most of both. And that's why professional people are out there. And if we can get rid of the stigma in our own minds, we're more likely to reach out and get some help.
Well, Dr. Matt, thank you very much for all the information. Once again, the help for the National Suicide Prevention Lifeline is 1-800-273-8255.
Oh, wait.
Ooh, our gift.
Hold on.
What does Josh get?
Josh gets...
This is what I'm talking about.
So this is a Pro Vans sticker that came with the very shoes I'm wearing today.
I'm so upset.
You're so upset?
Put that on your electric bike.
That's not the regular one. That's the Pro. That's the professional sticker right there.
What am I going to put that on?
Your electric bike.
What are you not going to put it on?
Your headphones, your computer.
I'm going to put it on that microphone over there and get yelled at engineering.
That's fine.
That's what's wrong with your generation.
I feel like I just won.
You're just not grateful.
No, I'm grateful
You're just
about
not
things
grateful.
that are awesome.
No, you
that could have been like
you poo-pooed before you even got it.
No. That could have been like
you wanted money.
A Big Mac.
You wanted money.
You wanted beard oil.
We got bills. Okay.
Beard oil.
Hey, thanks for
loved beard oil.
Hey, thanks for listening to Project Recovery. Once again, May is Mental Health Awareness Month, and if you do need help, call 1-800-273-8255. Project Recovery is brought to you by useonlyasdirected.org with a 3-part solution to help with the opioid epidemic: speak out, opt out, and of course, throw out. Project Recovery is a KSL podcast.
The contents of this program are for informational purposes only. The program is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician, licensed therapist, or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you've heard on this program. KSL does not recommend or endorse any specific tests, physicians, products, procedures, opinions, or other information that may be mentioned on the program. Reliance on any information provided on the program is solely at your own risk.